Okay, and we should be seeing participants coming into the room.
Reda, you have not started the broadcast. Should I do this?
So I am. It is recording.
Yes, but it's not open.
Oh, so I can't see that. Oh, because I'm only the co-host, right?
Okay, let me.
No. All right. Yep. Go ahead.
Okay. Now you have started. It's okay.
All right. Thank you, Vasiliki, and for participants coming into the room for this open webinar series. A warm welcome to you. I am Reda Sadki, here with Jan Grevendonk from WHO and Rizwana Sundarji from Gavi, and very pleased to be opening this second edition of the Open Webinar Series in Data Improvement Planning. Now, if you attended last year, you may have heard of the Immunization Monitoring Academy webinars. So this is the same. There's only a slight name change. The purpose of supporting countries that are seeking to improve the quality of their immunization data remains unchanged. I'd like to, we'll be using several different interactive tools in this session. So we're going to be taking you through what is required for each tool. So if you are a longtime scholar, have attended other WHO Scholar webinars, you may already know how to do this. So it may be a little tedious to have everything repeated, but yes, we ask that you, for your indulgence and your support to newcomers who are attending for the very first time. So the very first tool is in fact called Mentimeter. And you're going to get to use it right away. So we'd like to, if you are on your phone, you should be able to leave the session, go to your home screen, and tap on the web browser. And then into your web browser, type menti.com, menti.com. And then you will be asked for a code. Type the code 463852. Why go through all these steps? Because then you will get to answer your question and actually type the country that you are connecting from. So rather than telling us in the chat, there's so many of you are familiar and are doing, okay, wonderful. So you have a first participant from Cameroon who has figured out how to do it. So the process is to grab your phone, go to menti.com, and then enter the code 463852. So I'm going to repeat this until we see many more country names come in. So congratulations to the participants from Cameroon, Myanmar, Ghana, Indonesia, Mozambique, India, and the United States who have figured out how to, let us know that they're here. And you'll see throughout, we'll be using Mentimeter to ask you questions, and you'll be able to see the results, what you and your colleagues respond to different questions about data improvement. Here we're just opening up by asking you what country you're from, so that you can you get to talk back and contribute. And it's one of the two ways in which we'll be interacting with you, and you'll get to let us know what your questions are and answer specific questions in relation to the topic of the webinar. And of course, we appreciate for Ayemiya Chantar, for Chijioki Kuduru, Ramatullah Ramat, Jeffrey Mike Agunda. Yes, thank you for introducing yourselves in the chat as well. But actually, make sure that you've gone to menti.com and then type in the code 463852. 463852. Now somebody's typed the letter or the number 2, but we have Iraq, Brazil, Sierra Leone, Tanzania, and you can see the bigger the name of the country, the more participants have figured out how to use one of the two tools that we'll be using in this webinar series. So this tool is called Mentimeter. 53 people have voted. So please, just everyone can do this and participate in this way. You simply need to go to the website menti.com and then use the code 463852. So please, yes, all right, we have obviously the largest contingent of participants who have figured out how to use this from India, Nigeria, Indonesia, Myanmar, Ghana, Pakistan. So the bigger the more people answer, the more we will see the name of your country appear in the window. So how you do it, if we could see the slide again with the steps. Go to your phone, go to the website menti.com, and then use the code 463852. So 463852. All right, and we'll wait a little bit longer. Almost 100 of you have figured out how to do this. You'll be doing this throughout the session, so it's worth figuring out now. We'll be asking you some important questions about data improvement in your country, in your context. Whether you're working at the district level or in the capital city, we are interested in hearing from you, as well as sharing with you the expertise from the World Health Organization and from Gavi. So please participate. This is a way to have a voice. You will also be able to ask questions. We'll show you how to do that next. So 2 tools. You're already in Zoom. You've made it. You are, if you can hear me and see the webcams of the presenters, our presenters, Jan Grevendonk from WHO and Rizwana Sundarji from Gavi. You're in the right place for this first webinar series. Now you get to not just sit and listen, but you get to participate. And right now, 124 of you, which is a fraction of the total number of participants in the room, have figured out how to do it. So just go to your phone, and my colleague Alain Blaise Datsinku from the Scholar team is repeatedly putting into the chat the address of the website. So just click on what you see in the chat, menti.com. That will open up your web browser. You should still be able to hear me and follow along, but you will be presented with a screen that asks you for a number code. The number code is 463852. So 463852. If you're staring at the screen and you don't know exactly, you don't remember the number, 463852. And then you get to type in the name of your country and let us know that you are out there. And we'll be using the same mechanism called Mentimeter to collect, to basically listen to your voices and ask you key questions about immunization data improvement in your context of work. So it's important, if you're attending, that you let us know what is happening, how you see things, and you'll be getting various occasions to do that. All right, we've been at it for 5 minutes. We've got over 150 people who figured this out. If this is your first time attending such a webinar and you are not sure what you're supposed to do, relax. All right, we'll be coming back to Mentimeter, and you'll get more additional chances to answer questions and respond to prompts. So over now to Jan Grevendonk from WHO, who is, of course, the lead course contributor and for this webinar series, as well as for the course on the same topic. Over to you, Jan.
So thank you, Reda, and maybe at this point, can I also introduce my co-presenter for today, the co-host, who's Rizwana Sundarji. So Rizwana, do you want to also say something and welcome people?
Sure, thanks, Jan. So welcome everybody. We're very excited to be able to walk you through this very interesting topic. So as Jan said, I'm Rizwana Sundarji. I work for the Gavi Alliance at the Secretariat, and I'm actually part of the monitoring and evaluation team. So welcome to everybody, and then very happy to answer any question that you may have as part of this topic discussion.
And I'm Jan Grevendonk. I work in the World Health Organization in the immunization team in data.
All right, thank you, Jan and Rizwana. So we're going to remind you, for those of you who are returning scholars, and warmly welcome those of you who are attending for the first time. And here are some ground rules. I'm not going to read through them. I trust you to do that. But just to emphasize, we're using different tools each one, because is a powerful tool, but if you've never used it before, you're going to have to figure out how to do that. So we have Zoom to connect to the webinar. So if you can hear me and see me, you've made it to Zoom. We'll be using menti.com for the polls, so they're not really optional. We actually want you to just let us know how you see things in response to specific questions. Then there will be the Q&A tool. I think we have a separate slide to show that. But basically, we're especially interested in hearing from your experience. Of course, we'll Jan and Rizwana will be presenting some very important information and content about data improvement, but we also are hosting this webinar to hear from your voices and your experience with respect to this important topic. And then before anyone asks, if you will be able to get the slide deck, the answer is yes. Okay, so, and in fact, you can see the tinyurl.com address. If you click on that, you'll be able to get all of the address. And I see some folks have figured out how to so click on the raised thumb in Mentimeter, but even more interesting will be the raised thumb in the Q&A. So one thing, if you want, we very much want you to share with your colleagues as well as with the panel. So there is a small option here where at the bottom of the chat window, you should see an option to send your messages to all panelists. And this is the default, which we are no longer able to change. You have to go and select all panelists and attendees. That is how you will ensure that if you share a message in the chat, so yes, that your colleagues, other folks attending the course will also see it. Now, this is probably the second, so this is the second tool. So this is really important that you understand how this works. If you're looking on if you're using Zoom on your phone, if you're connected using your phone, you can see what the interface should look like. You should be able to find the Q&A item, a little button that says Q&A inside it. If you click there, you'll see it opens up a window where you can ask your question. So you can just type away your question, then click on send. Now, this is important to do early on, but please give Jan and Rizwana a chance to present, because many of the questions, of course, they will be addressing through their presentation. But once we get started, do not hesitate to submit your question. And actually, even more important, because there's so many of us in attendance for this webinar, we're going to select the questions and ask Rizwana and Jan to answer them if they receive at least 20 votes. So it is really important to review the questions that have been submitted, and the ones that you'd like to see them answer, tap on the little hand with a raised thumb. You can see where it is on the slide. That's really a really important step. We will identify the best questions, by looking at which ones have received at least 20 votes. So super important that you participate in this way. We know it can be hard to keep up, to be reading questions and submitting questions and voting for questions as you're following the presentation. So we'll try to maybe mark a pause and indicate where it might be better to go and vote, at least vote for some of the questions. And we'll be selecting questions and asking Jan and Rizwana to answer them. Back to Jan for the overview.
So thank you, Reda, and again, so nice to see so many of you here in the webinar. As Reda said, this is second time, the second series of these webinars, but we try to change it a little bit so that even people who were there last year are not having the same exact content. So we try to update it a bit. So we did the introduction and start. We start with talking about what is a data improvement plan. Then we will talk through the components of a good data improvement plan and best practices. So we want to show you some pictures. And then in the end, it's very important for us that we kind of leave a lot of time for questions and answers, but even more so to give you the floor to share your experiences. So if you have really good things you wanted to share with the group, with us about what you have done with data quality assessments and improvement planning, we're really looking forward to hear that. And in the end, we're going to finish by just describing the next series of webinars. So this is the first in a series of 6 webinars. So we'll actually describe what's coming up. But first of all, we want to ask you, where do you work, at what level in the system? because for us, it's really important to know like who is connecting to these webinars so that we can fine tune our messaging. So the first person is from a health facility. You can also say district at the national level, state or province level, and global and regional level. And by the way, I have been for the first time, I've been to a meeting last week in the EMRO region. So and it was really nice to actually have a lot of people who were in last year's webinars and or data improvement plan course and come up to meet me and say hi and say that they enjoyed it. So for me, it's also really nice to hear from all of you.
Great.
Right, so it's really nice to see that we have again a mixed participation. So there's people from the national level, a lot from the state and provinces, and then also from the districts and health facilities, which are of course very important for data quality, improvement and use. I'll let it open for just a little bit so that you can all tell us where you're from.
And just to clarify, I see some participants who are answering in the chat. That is not what we're asking you to do. The chat is for you to communicate with other participants. Here, we need you to go to the website, menti.com, and use the code 463852, and then you'll be able to vote, and your vote will show up right away on the screen. So that's just, that is how you can get instant feedback and actually contribute. So please do not answer in the chat. For Jan Philip, who just told us he works at the district level, please go to menti.com so you can tell us. Same for Paul Twene or Olivia Teba or Abdoulaye Konate. If you answer in the chat, I can see it, but the panelists may not see it. Where we really want you to go, as 135 of your colleagues have done, is to go to menti.com and use the code 463852. So it's really worth doing that. This is how you can let us know, that you are there, you matter, and we want to hear from you. So that is why we're using this amazing tool called Mentimeter. So for Obed Nuobe, I know you work at the district level, but if you want Jan and Rizwana to know, please go to menti.com and use the code 463852. 463852, and then you can select the answer. And 170 of you have now put in your vote. So well done. And for those of you who are not there yet, there'll be another question coming up, and then you can have your browser ready or your phone ready so you can go to menti.com and use the code. The code won't change, the questions will. Back to you, Jan.
Yes, thank you, Reda. And of course, we appreciate it can be complicated if you have only one phone and you're using that for Zoom, to also use that phone to open a browser and go to menti.com. But as Reda said, it's actually nice to make it interactive this way. So thanks for the effort, and thank you for everybody who's voting. So it seems that, yes, we have indeed most people at the subnational level, which is great, because you're actually probably the people that matter most, together with the national level, who can really help kind of coordinate the data improvement efforts. So I'll move on from this slide. Thank you for answering. And we'll start with a little quiz, and it's about Gavi data requirements. So after that, I'm going to hand it over to Rizwana to give you the right answer. And if you're still at Mentimeter, we ask you to consider whether the 5 activities that I have listed there, whether they're part of the Gavi data requirements. And just to say, Gavi data requirements mean things that Gavi requests from its member countries to do. And the options are to perform a desk review of immunization data at the yearly basis. The second one is to conduct regular coverage surveys, so ideally every 5 years. The third one is to perform an in-depth review or evaluation of your data quality and systems quality. The fourth one is to have a data improvement plan. And the last one is to invest in an electronic immunization registry. So you're all sharing what you think are data requirements for Gavi, so things that Gavi explicitly would like countries to do. And it seems that a lot of you think that the data improvement plan is a must. To have at least yearly desk reviews seems also important. Conduct coverage service as well, perform in-depth evaluations such as DQSs, DQAs, DQRs, whatever you want to call them as well. And then invest in an electronic immunization registry gets so far the least votes. So after this, let's turn it over to Rizwan, and then she can also tell you more about what a data improvement plan is.
Should we wait a couple more minutes, Jan, or?
I think we're almost there, so I think
okay. All right. So I think this was a very trick question. In fact, because not every country who's represented in this webinar is actually a Gavi supported country. But the trick was that there was more than one activity being proposed as actually a Gavi data requirement. In fact, the first 4 ones are those that are listed in the Gavi application guidelines and are being monitored through sort of regular routine Gavi processes. The last one, which is the electronic immunization registry, is not a requirement. Gavi is always happy to support a country's journey in improving their data systems. And for some countries that might actually, entail rolling out or scaling up an electronic immunization registry, not a requirement of Gavi that every country must have an electronic immunization registry. In fact, in some contexts, it may not be actually appropriate to consider that. Next slide, please. Yes, thank you. So going back to the basics, what is a data improvement plan? Well, in effect, a data improvement plan, it is a document in and of itself, but hopefully it's much more than that. And what that document outlines for us is really an assessment of the barriers that you are facing that prevent you either from collecting data or from the fact that that data is not of good quality, but also your ability to use that immunization specific data. And the idea with that plan, and it does include the word plan, is that we propose a way forward on how we're going to address the barriers that you have identified, but in an actionable and impactful way. And of course, the last piece is that this plan will help you determine how you will implement these activities and how you will be monitoring them. So just a quick note here, a data improvement plan doesn't necessarily mean that you have a long list of actions, but it could be very reasonable in certain contexts to have a very limited set of recommendations. The point is that you want them to be actionable and impactful. Next slide, please. So going back to menti.com, we'd like you to sort of answer this question. Why do you think data improvement plans are not always effective? I'll pause here for a few seconds, a minute, to let you answer. And what we're asking you to do is to rate every answer and let us know if you agree or disagree with each statement. So it seems that no one's answering as of yet.
And maybe I can just read the options if you want, if you like. So the first, there's a lack of knowledge of how to develop a data improvement plan. The second one, that recommendations are there, but they're maybe vague and they're not actionable. The third one, that for the there might be a data improvement plan, but there's no ownership of it, so the report sits on the shelf. The fourth one, that some of the biggest problems think about denominators, that they have no obvious solutions. Do you agree there's a lack of funding for implementation? And do you agree that the interventions that you do, they don't always lead to the desired outcome? So we're trying to find the barriers here of why are DIPs not really changing always the situation on the ground.
And it seems that the lack of knowledge is coming out to be one of the biggest barriers, and it's followed up by the lack of ownership, and that's true in many cases. That can be quite a barrier to overcome. And then followed by the lack of funding for implementation. And then the last three are sort of close to that. So recommendations being vague and not really actionable. Sometimes that the biggest problems we have no obvious solutions, and it's unclear how interventions are resulting in desired outcomes. So we'll carry on to the next question that I have for you, and then after the next question we'll have a chance to let you comment on your experience as well and share a bit of the challenges that you're facing. So in your context, what are the three main issues with data quality and use? And you have 5 answers that you can select from. So the first one is HR issue. It could be either in terms of capacity or motivation or even staff turnover. The second one is relating to denominators and the estimation of the target population. The third is your information system not performing well enough. Fourth is the fact that you don't have sustained investment for improving data quality and use. And then the last one is around data falsification or untrue reporting. So it seems like target population estimation is coming out to be the biggest issue, followed by HR. And then we have the financing aspect, as well as accurate or inaccurate reporting. And then the last one, the system's performance, is mentioned, but not as frequently as the other four options. So now perhaps opening the floor to you, I think we'd be really interested to hear from you and to sort of understand what has been your experience to date with assessing data issues, but also trying to address them. So how do you plan around those key recommendations? So we invite you to go into the Q&A and perhaps ask a few questions, and we can select a few and let you sort of share your experience.
Yeah,
so there's
as Reda said before, it's also important that you maybe read other people's questions and kind of things you would like to hear about and kind of give them a thumbs up, a like, because that way we know that there's a lot of interest in that question or that experience, and then we'll give you the floor just after the short presentation that Rizwan and myself are going to go through. So please, everybody do the Q&A also and kind of put in your experiences there. And I'm seeing that actually quite a lot of people have already done so, and a few of the questions about denominators and about security areas already have quite a lot of likes. So that is looking good. So also, like it's maybe not surprising that many of you say that so many people probably don't know about how to go about making a data improvement plan. So the good news is that we have this webinar, and also we have a series of Scholar courses on making data improvement plans. So we're trying to fill that gap a little bit. So this is, we're going to talk you through the framework that we developed for data assessment and improvement step by step. But just to say that there's kind of 5 big steps. We'd like you to start with kind of a systematic review or a critical review of your systems and organization in your country, looking at the people, the tools, the processes, and the governance that are in place. Then actually do a desk review of your data. Try to find out what you can learn from there. Are the data consistent? Are the coverages over 100%? Is dropout sometimes negative? What if you compare VPD surveillance with immunization coverage? And what if you compare the survey results with administrative data or reported data? So what does that all tell you, right? Even before you go into the field, and the field review is maybe a step that we all know a bit better. It's about a data quality self-assessment or a review or whatever you want to call that, but it's often a process where you go with teams into the field and you have the chance to interview health workers. And then all of these 3 phases are kind of the diagnostics phase, which should lead to an improvement plan. Right? The improvement plan really needs to then kind of take all that information and try to dig really deep to find out what the root causes are before you make recommendations and think about an action plan. And of course, ideally, your plan is such that it can be implemented and monitored. And I went through this framework very fast, so don't worry that you didn't get all the details, because now we're going to go into each of these boxes step by step. But just basically to say that a strong data improvement plan, or DIP for us, contains the following key elements. So a good diagnosis that is based on evidence or on something, some source that you can refer to, and not just opinions, because often, like the data improvement plans we see, they state, for example, that people are not motivated or not knowledgeable, but really then we need to have that backed up by some evidence. A good data improvement plan also has kind of prioritized, feasible, and impactful recommendations. So there's a lot of words there. Prioritized meaning that there shouldn't be 50 recommendations because that's too much to handle. So maybe 10 is a better number, but definitely not 100. They should be feasible. So if somebody recommends this to you, you should be able to take that and do something with it, and potentially impactful. So they might change the course of data quality and use in your country. Ideally, such a data improvement plan also has a plan of action that has specific activities, roles, responsibilities, budget timelines, and finally, ways to monitor and evaluate your progress. Did I just steal your slide, Rizwana? Sorry, I think
No. You're okay.
Okay. So the first part, which is actually very important, which not many people do, is to critically look at the system. So first of all, you should take any previous assessments and recommendations and ask yourself, are these recommendations being implemented? Or if I'm going to do an assessment, am I going to have to make the same recommendations? So often you see that a plan exists, recommendations are there, but they're not being implemented either because they're not very precise, or because there was no ownership or there was no funding. But anyway, the recommendation still stands from so many years ago. You should probably also review your SOPs and guidelines. You can also talk about the system by organizing focus group discussions and interviews. And something that's really important and interesting is actually take all the paper tools that your system uses and put them next to each other and try to see if they make sense, if they're well developed, if they fit together, if they're consistent with each other. If you have a computer system, you should also review that and any organigrams that are there, for example, especially if you have an HMIS, an EPI, an implementation arm of your public health, etc. And in the end, you should probably kind of develop something like a SWOT analysis that has the strengths, weaknesses, opportunities, and threats for your system. Now, last year, we showed you a bit the same thing. And what we showed you then was actually examples from data improvement plans that existed and that we knew about. Now, this year, we took a little bit of a different approach. And what I actually did, I harvested good examples from last year's course on data improvement planning. So I'm going to show you some of the tools that people actually showed and included in their data improvement plan in the Scholar course last year. So first of all, there's this example from Marcela Contreras, who was a 2018 Scholar, who did a good job of mapping all the paper tools in the country that she was working with. So she describes what paper tool was used for which purpose and how it all fits together. And then ideally also it has kind of a one-by-one analysis of, is this a useful tool? Is this user-friendly? Can it be easily filled out? And do they all go together? Is there some overlap maybe in these tools? That's a very useful thing to do, especially if you can look at these tools with a number of people together and you kind of have a brainstorming about, if you were a nurse and had to fill out all these things, would you be happy doing that? Second thing that I mentioned is a data flow chart. It's also really important to understand how data flows in our country. And this is an example from Charlotte Nyua Mbu, who I think is from Cameroon, and made a nice flow of all the data as it goes before the 5th of the month to the 24th of the month when it gets to the central level. And she also talks about the EP-Info tool, the DHIS2, the DVD-MT, the monthly reports, and you can already see that there's a variety of tools at work in that country and they all need to be filled in and they all need to kind of somehow work together. So she kind of used that to introduce some of the problems that she was seeing in that system. Here's an example from somebody who was actually a co-host on the call. So this is from Alain, who made a really nice SWOT analysis for his country, and I think you were working on Haiti. And you talked about the strengths, weaknesses, opportunities, and threats for each of these big buckets. So talking about governance, human resources, the data management tools and equipment, and the coordination. So I thought that was really well done and gives you a good overview of the problems and the needs in that country. And then I'm going to hand it over to you for the next step.
Thank you. So the next step is really sort of doing a data desk review. And just to stress here that this step, I mean, you can do it as part of an in-depth systems assessment, but in fact, you should really be doing this routinely at all levels of your health management information system, so national, subnational. And this practice really allows you to kind of be able to not only detect issues with the data, but also start to think about, what are some of the root causes, and therefore, what are some potential interventions that you might consider as you start developing your data improvement plan. So ideally, some of the analysis that you would look at in a data desk review would include obviously coverage, but not just the coverage estimate, but also the numerator and the denominator. Looking at different sources of data. So we look at, obviously we have administrative data, but we have other sources as well. Survey data, you could look at surveillance data. I know that in some countries, they've also taken a look at their stock data, for example. I think it was the Democratic Republic of Congo that did that 2 years ago as part of their sort of annual data quality desk review. And really, as I said, this is kind of to set the baseline and for you to be able to see, where are the issues? Is it really in terms of timeliness or completeness, or is it more in terms of the consistency between the different sources? Or am I seeing trends that really don't make sense over time, given my understanding of the immunization program? And then the triangulation piece is the piece that you're able to do when you look at either different sources for one same information, or looking at sort of two pieces of information that help you understand the state of play of your immunization program. So a few, similar to what Jan did, a few examples that we pulled from previous scholars. So this chart, it really is it's a very simple exercise that many of us can do on a routine basis. It's really looking at the number of children vaccinated month by month for either every region or district, and looking at inconsistencies. So for example, if you take the first row, in March, for Bakul region, we had vaccinated 353 children. In April, we have 50. This is a bit bizarre. So, you would query this and say, is it, was there something that happened? Did the vaccinator, for example, resign, and therefore there was an interruption in the service, in which case the data makes sense? Or did we forget to input some data, for example? Other specific examples that you may come across is when you have districts or regions, maybe so more districts that are reporting always figures that end in 0 or 5. So that, kind of sends a red flag. Another good example from Nigeria, looking at the difference, so the next slide, please. Looking at the difference in coverage from administrative and survey data for different antigens and doses. So we see that the survey, for example, yields very different results than from the administrative data source. And so asking ourselves the question as to, why do we see this difference? And really trying to understand if it's issues that are systemic, so relating to your health information system, or issues that may perhaps be linked to the survey itself as well, not to be discounted. And then the last example. So actually, this is an example that even was cited as part of the Gavi report from Myanmar that was put together in 2018, and looking at coverage and BPD cases and trying to understand if it tallies. So if you have, for example, some regions or states or some districts that are reporting very, very high coverage, and as you can see, sort of the south part is quite green of Myanmar. And then on the right-hand side, you see the red spots that indicate some cases of measles. Does that really make sense? Should you expect measles cases, for example, in an area where you have good MCV coverage? So that's something that you can use in order to kind of further question the quality of your data. And then lastly, another quite interesting example from a 2018 scholar looking at coverage across different equity dimensions, and trying to sort of understand what that means and what would be the programmatic implications of that.
Thank you, Rizwana. So back to me. So then the next step is to do a field review. So after you do your desk review and you critically looked at your systems and you looked at your data, it's time to actually go to the field. And this is actually a unique opportunity. First of all, to see how policies are understood, how they're implemented by health workers, and what their challenges are. So I normally or typically, how this will be done is you have a qualitative questionnaire, which is a number of questions that you ask at each of the levels, which you could also see as an interview guide. So the most important thing is actually not to collect a lot of data, but really to come to an understanding of how health workers engage with data, what their challenges are, and what they have to tell you. The second part is kind of some kind of quantitative verification, where you kind of recount data that should be the same at different levels, and then you just compare it and see if they are the same. Just also to say that this can be done using coverage, for which it's often done, but also, for example, for VPD data or even kind of logistics data or whatever you can think about, as long as you have a system that reports something up the chain, it makes sense for you to, from time to time, see if actually you have consistent information across all levels. Here I have some examples also, but they're not from the Scholar course, because in the Scholar course, it's an online training, so we don't really do field reviews. We haven't organized that. So I'm going to take the results from some actual field reviews. So in this case, this was in Indonesia, a field review that was just done, where we kind of look at kind of the results of the questionnaires. And then you can see, for example, here at the province level, that first of all, you have differences between provinces. That's always the case. But also in some of the areas, the scores that we had to give, or our evaluation of how good it worked, was a bit less than in others. For example, in this case, analysis and use is probably the weakest one. Recording and archiving is probably the best one, and you can easily see that at the glance of an eye. I also said we do some verification. So what that could mean is that you recount reports and you compare them to computer databases, or you look at the national level database and you compare it with the district level database, or as is shown here, this is in the last level, so the service delivery level, what's called Posyandu in Indonesia. You can actually look at the report that they send to the health facility, the Puskesmas, and then recount that in the cohort book, which is the child immunization registry. And it's interesting, in this case, you have two of these Posyandus, and in one case you see probably either a little bit over-reporting, or the fact that they don't register all the children in the cohort book. For example, migrants or transient populations might not be in the cohort book. And in the other one, you see that there's actually many more children in the cohort book than is being reported, so there might be some under-reporting there. So that's typical, and people who have done DQSs or DQRs have seen reports like this. Something that was interesting in the same review is that we tried to do the same thing with VPD data. So we try to compare measles cases from different sources. So here you see EWARS, which is the early warning system, which is an aggregate system. And you see already that there's kind of a problem, because there's little follow-up on the numbers of cases that are sent to the lab from all the suspected cases. But also, like in the VPD system, you see that actually there's no case-based, no case investigation forms that are even started for each of the suspected cases. So that was also an interesting finding in a very different area. Finally, I think one of the most important things to do with a field assessment is also that these things really allow you to collect best practices. So you're going to a health facility, for example, there on the left, and we were really impressed by the quality of data that they present on the wall. There was even a different health facility that I don't have a picture for, but they even had a list of unimmunized children on the wall, so that people in the community could help find them. So that was also interesting. And a timeliness and completeness chart at the province level, for example, on the right. So it's really nice to actually take these examples and then share that with the other provinces and the other districts and health facilities that you visit.
So now, once you've kind of looked at your data, then you've done your data desk review and then gone to the field to sort of confirm some of the observations that you've made from your desk review, it's the time to plan sort of the interventions or the recommendations. But in order to make sure that those recommendations are effective and that are going to lead to tangible changes, you need to make sure that these recommendations truly address the root causes of the problems that you've detected. So really going through a kind of almost like a problem tree type of exercise. So for example, if you see that, I don't know, the registry is not filled out appropriately. So why is the registry not filled out appropriately? Well, is it because the healthcare worker is not trained, or is it because they don't have the right registry, or is it because of a combination of two, or is it because, you know, that the healthcare worker doesn't really is not feeling motivated to complete it because he or she doesn't understand how that data is being used? So all of that process, which can be actually quite demanding, is really, really important in order for you to make sure that you pick the right interventions that are going to have the greatest impact, if you want, in the short, medium, and long term. And also, the risk when you start developing your improvement plan is that you end up with a long list of recommendations. I think we've all gone through that process where there's been an assessment, and then, you know, you go back to the different actors and you see that there are 25 or 30, 35 recommendations. How are you going to be able to prioritize those? How are you going to be able to find the financing in order to implement those activities? That you can do better if you really understand what are the underlying causes. And then your plan in and of itself, once you've done that and you've identified sort of the core activities that make sense in your context, it's really to think about what are the timelines, who's going to do what, where are you going to get the money from, and then how are you going to measure your success? So what is the key outputs or outcomes that you're seeking to, and really forcing yourself to be far more specific and realistic than just saying, for example, I'm going to reduce the difference between administrative and survey estimates, which in and of itself could be a very honorable objective, but I think in the short term, it doesn't necessarily help you understand which activities you need to prioritize. So the next slide really shows you how the root cause analysis is a critical step in that process. So for example, here what we see is that the main problem statement that we've observed, I don't know, from a field visit, let's say, is monthly reports are not well filled and they don't match with tally sheets and register. And I think this is an issue that is cross-cutting many, many countries. I think everybody's gone through that particular issue. And so some of the sort of main hypotheses that we might infer are that healthcare workers may not know the process or use of the tools. The healthcare workers know, but the system is too burdensome or complex. So for example, if you have parallel reporting system for immunization data, you have DHIS2 and another system concurrently, so that, you know, the burden of work on that particular healthcare worker might be very high. And then again, that similarly to what I mentioned below, is they're not really motivated because they don't really see the value in reporting. So then how might we start addressing some of these? So obviously we can think about different trainings, developing standard operating procedures. We do some supervision, but maybe thinking about how do we make that better and how do we make use of that. Revising the tools themselves and thinking about sort of putting ourselves in the shoes of the healthcare worker. So almost kind of testing it and saying, you know, if I had to kind of complete this form, would it make sense? Would I understand really what is being asked of me? And then of course, simplifying the reporting requirements it looks very simple when we write it, but it actually can be a very daunting process for many, many, many countries. And then when we talk about, or when we reflect on the value of reporting, obviously there's, you know, the fact that you want to try and make sure that there's a feedback loop. So if people see how the data is being used, so the data goes upward, but if you can send back something back to them and say, look, we've analyzed your data, this is what it looks like, have you guys looked into this? I think then that triggers a conversation around, you know, oh, this is how I can use the data, therefore it's useful, therefore I should make sure I record it appropriately. And then again, the superative supervision, which is we've known this for a long time. It's a key activity, but it's more around how do we leverage this routine key activity and help us improve the quality and availability of data. A few examples of root cause analysis that we found quite helpful from previous Scholar series. So this one from, and I really apologize for my poor pronunciation, Ignatius Anclife. You could see how he tried to unpack some of the root causes of poor data quality in his region, and some of the key assumptions or sort of statements that he was able to kind of come out of this process with related to sort of poor data management, capacity of staff, inadequate standards for registers and tools, the staff attitude towards their job, and then the inadequate monitoring and supervision at all levels. The other example is actually more of a sort of a action plan. And what's really nice about this particular example is that it's kind of drawing from a Gantt chart type of format, so you can really see visually when each of these activities are planned, and you can see that some of these activities are more routine, like superative supervision. So it's more, how do we make sure that routinely we do this well, and some of them are more discrete and actually can be quite meaty. So developing and endorsing an HMIS policy requires a lot of work, and it summarizes a set of sub-activities that probably the EPI team would then need to flesh out a little bit more to make this plan even more actionable and usable for implementation purposes. Speaking of implementation, so the last step of the framework that Jan presented is actually implementation. So being able to mobilize resources. So I'll speak about the experience of Gavi supported country, because as we mentioned earlier on in the webinar, having a data improvement plan is a data requirement of Gavi for Gavi support. And as part of that, as part of supporting countries in being compliant, if you want, what Gavi does offer is also the ability to support their data improvement plan as part of sort of the grants support that we are providing to countries. And so I guess in that particular context, sometimes the question of funding is slightly easier, but trickier in a way, because what you want is you really want true ownership, and in that particular context, being able to advocate that supporting data strengthening issues is something that should be done routinely by the ministry, and really the immunization team should be thinking about as much as you're planning, for example, your outreach sessions or your fixed immunization sessions, what are the core data improvement activities that you need to think about, which are of course coming out of your systems assessment. And then as part of that process, obviously thinking about how am I going to monitor, not just making sure that the activities themselves are being conducted. So for example, you might monitor the number of sessions, supervisory sessions that have been conducted, but are you really sure that these sessions are actually yielding the expected results? So if you're not, then how would you go about monitoring them? And then thinking about the evaluation component. So there might be different innovations, or there might be different activities that you haven't tried before that you are thinking about implementing as part of your data improvement plan. In that particular case, do you want to have an external evaluation being conducted for it? Even for the routine activities, once in a while doing sort of a review of those is really, really helpful, because it helps you understand what is going well and what needs to be course corrected, and the implications of those course corrections those might have on your data improvement plan. I know we've gone really quickly, but I think now we're going to open it up sort of to you. We're going to go to the Q&A, if I'm not mistaken, and try and sort of answer some of the key questions that you have, and then we'll also give you an opportunity to share overall your experiences with us and with the rest of the group. Thank you.
Thank you, Rizwana and Jan, for taking us through this presentation. Right now, we have 3 questions that have received more than the requisite, actually, 3 questions that have received an impressive number of votes. So my suggestion would be to start there. This is the process as we ask people participants to play along, and then of course there's some really interesting comments that I'm sure you and Jan have spotted. So would that be okay to start there? And of course we can try to go, for example, to Mebrahatu Gebrhidan, who asked this question that has received 57 votes and many comments. We perhaps could go to him and ask him to just share his question and explain why he's particularly interested in this. So that would be my suggestion. Jan, shall we start there, or would?
Absolutely.
So let me go to Mebrahatu. I saw that he was in the session. So Mebrahatu Gebrhidan, I have activated your microphone. You now need to unmute yourself in order for us to be able to speak to you. So if you could do that, that would be wonderful. And we can hear firsthand, then you can tell us, introduce yourself and introduce your question before we ask our panelists to comment and respond to it, as well as to look at what some of the comments have been. So we said this would be participatory. So this is now your chance to literally make your voice heard. But for that, you need to have a working microphone. So Mebrahatu, if you are listening, your question received many votes, obviously showing great interest in this question of data improvement in hard to reach and security compromised areas. We'd like now to hear from you, but it looks like that's not going to be possible. So let's go to Jan and Rizwana for response, comments, additional questions on both the initial question and the comments underneath. There's quite a few people, such as Mohammed Wajid Ali, who said this is a serious issue. David Kanu, who made a comment about supportive supervision. I'm not sure what the intent was. Temilola Esther, and others who have made comments on this.
Yeah, shall I start and maybe Rizwana, you take it after that?
Sure, yeah.
Like teaming like that. Okay. So first of all, the security compromised area. So yes, of course, that is a big problem. It's like, I think the biggest problem for security compromised areas is often the denominator, the estimation of the target population. So really, it's already hard to find out how many children need to be vaccinated in those areas, where to find them, how best to reach them through the different strategies. So I think denominators are really quite hard. So the second part then is probably kind of the coverage data and see if you fulfill that target or not, which is also kind of hard because there's so much uncertainty about the denominator. But I would also add to that in those security compromised areas, often of difficult access, maybe the most important thing is to make sure that the services are being provided as planned. So I think it's often time to take a step back and actually kind of, first of all, monitor whether sessions are being held in those areas, whether vaccines are there, whether skilled personnel is there to actually administer them, etc. The second one, to have some sense of the target population, which can be very difficult, but sometimes can be gathered together with kind of like intelligence from polio campaigns or things like that, who actually also make enumerations in those same areas, and we can maybe leverage some of their work. Finally, I think there's new approaches using GIS, so Geographical Information System, and the use of satellite imagery that actually help you kind of estimates how many people still are in an area, even if there's kind of an ongoing conflict going on. And again, Polio has a lot of experience with that. Now, that being said, I don't think that we will get the data perfect for those areas. And maybe that's not even the objective. Maybe we really need to find out what we need to do and how far we want to get in those areas. And then kind of get data that are good enough for that. Rizwana, do you want to add?
Yeah, I think Jan's last point, I actually was going to mention that it's really about sort of basing the right expectations, that in that particular context, like let's not be too sophisticated. You know, if we get just the basic data, even if it's of kind of varying quality in and of itself, it's still useful to be looked at and for programmatic use. The other thing I wanted to say is that in Afghanistan, so I'll just maybe relate the experience of Afghanistan. So in Afghanistan, there is a data improvement plan that's ongoing, and the funding, which Gavi provides a lot of it, most of it, will end next year. But one of the key learnings that we've seen come out of it through the external evaluation that is ongoing is the fact that they've actually invested in the capacity of data managers at the provincial level. So it wasn't necessarily beefing up substantially, I would say, the central level M&E capacity, but it was really looking at the lower level and thinking about the people who are closer to the field. How can we help them collect basic data and do basic analyses? And the production of these basic analyses has really triggered sort of a different way of planning their immunization activities at the lower level. It's not perfect, obviously, but we've seen that that has kind of helped in making sure that the routine system is working. So again, sort of going back to basics and saying, you know, what is the minimum that I need to do and how can I make sure that it's done more or less okay?
Okay, thank you both for those answers. I'm sorry we couldn't get Mebrahatu Gebrhidan. There's one other. Are there additional comments that you'd like to make on this issue, or shall we move to the second question, which has received a very large number of votes, reflecting high level of interest from the participants, which is a question from Kaysar Abbas.
Just also to say, Ray, that a lot of people are putting in the chat box, they're also sharing their experiences. I think a lot from Nigeria, from Borno State. We have the Civilian Joint Task Force, the VTS, so that's also in Nigeria. So there's actually things that are being shared, and I would actually encourage people to, yes, share those experiences. Also put them in the Q&A as kind of answers to people's questions so that we can keep track of it, because it's really good to get your field knowledge about all this.
That's a really good point. So yes, indeed, the best place where you can, would be to share your experience in the comments to the relevant question that's been asked, or the question that's related to your experience, so that when we turn to that question, we can actually hear from you perhaps about it. So Kaysar Abbas has a question: how to improve data quality at Union Council level when accurate denominators are not available? So we're going to try to, yes, we're going to bring him into the panel. And Kaysar Abbas, if you could unmute yourself. I've activated your microphone, so you're now able to speak to us, but you have to push on the button or tap with your finger or with your mouse to actually turn on your microphone. And of course, your microphone needs to be working. That's the second part of the equation. So it seems like you have turned on your video, which is, or trying to, which is great, but we actually need you to turn on your microphone because right now you are muted. So, and then we would be able to hear from you so we can hear why you asked this question, when, of course, you can introduce yourself to the other participants. And again, as with, unfortunately, as with Mebrahatu, we may not be able to. So these technical issues are normal and healthy. They're just part of yes, life and how we do these webinars, connecting hundreds of people from all over the world. So let us turn to Jan and Rizwana. And if you see in the comments, of course, someone who you feel be worth, it would be good to hear from, to get either to get a better understanding of what they shared in the comments, to share their context, or to share their experience. We can do that as well.
I can start if you want, Jan.
Sure.
Okay. So I think Kaysar Abbas, I think you are from Pakistan, seeing the way in which you've formulated your question, but please correct me if that's not the case. So I think Jan touched upon some of the ideas relating to the improvement of target population estimation. Some of these innovations or interventions are actually applied in different parts of Pakistan. So the GIS mapping, for example, looking at how we can use GIS data to better understand where populations are and overlaying service delivery related information. So looking at, for example, the number of outreach sessions that were conducted, your fixed EPI sites, and seeing, you know, to what extent are actually population covered. And then that gives you a sense of, okay, maybe not the actual number, but with spatial imagery, it sort of allows you to understand you know, the magnitude of the target population you have, and perhaps at least the areas where you are not able to cover. But it is tricky, and I think that all of it depends again on sort of how far you're willing to go to improve your target population and for what purpose. And if the idea is really just to say sort of, I need better target population estimation in order to understand how I need to organize the delivery of immunization services. Some of the interventions that Jan mentioned are really helpful for that, because it helps you visually see which areas you may have missed. In terms of if it's more from the perspective of saying, no, I really want to monitor and to be able to understand if you know, children are being vaccinated or not. I mean, surveys is one way where people get this kind of information, but again, thinking about, okay, what routine measures can I consider in order to improve my administrative system? So if it's, and that would entail you unpacking what are the issues that are related to that. So is it more a sense of like, you know, people are not able to understand how to complete the forms, or is it that there are some districts or union councils that are silent, they're not actually responding, they're not reporting back to the district, so actually understanding what's the issue there, for example, unpacking it further. I don't know, Jan, if you want to add a couple points to what I said.
Sure, and good discussion. Of course, this is a classic one on the denominators. Just to say that denominators, of course, if they're census-based and projected estimates of people, they tend to be relatively good at the national level for most countries, not for all countries, but for most countries, it's adequate at that level. And then the lower down you go, the worse these denominators become, because it's really hard to estimate like how people moved, where the growth rate was higher, if there's things like urbanization, etc. So at the union council level, which I understand is a very low level, it's kind of the health facility or the catchment area level, it's indeed very hard to work with some of those population estimates as denominator. And in those cases, sometimes it's actually more important to really think, okay, what is the best data I can use for micro planning and for actually ordering vaccines, so what we would call operational targets, more than really kind of coverage monitoring and really have like a coverage percentage that should make that should use kind of official population estimates. So what can also help, I think, apart from what Rizwana said in some countries, is that you can use last year's data on the number of children that were immunized in your union council to see if this year it's lower or less than that, because ideally you don't drop too much from there unless there's a good reason for that. The other way to handle that could also be through local enumeration, as we call it. So where people actually go out and go door to door and try to enumerate households and families and find out like who lives in the catchment area. And that of course is a risky process because we're always at risk of missing out on people. So in that case, we really need to make sure that all the population in the district is covered. And really what it in the end comes down to is that at least at the district level officer can sit down with the people in the health facilities and the union councils and whatnot to say, okay, have we all the populations in this district covered? Who is doing what? What is everybody's target? And then make sure that the target that is distributed to health facilities adds up to kind of the district level denominator at least. So yeah, I think those are a few of the tips I can also think about.
Yeah, and I think in countries like Pakistan or Afghanistan, as you had mentioned previously, leveraging some of the polio data is probably also a good entry point to getting better estimation of your targets as well.
All right, thank you both. We have, I spotted Olivia Tebe Ateba Ewokolo, who made a comment, I think, with the denominator problem, activity should be planned with community involvement to reach every child. So I wondered if Olivia might be interested in sharing her experience in this respect. Olivia Teba Ewokolo, I've activated your microphone. If this doesn't work a third time, yes, Olivia Teba Ewokolo, are you able to speak to us today? All right, your microphone is unmuted. You maybe have some adjustment to make. Okay, wonderful. Olivia, welcome. You made this comment, and we would love to hear what, just can you tell us?
Yes, thanks very much. Because the denominator problem is a very big problem almost everywhere. And the problem cannot be solved at the local level. So to improve on the immunization coverage and to reach every child, we can plan with the community, in collaboration with the community, so that all newborn children who enter the vaccination calendar are identified and followed up both at the health facility and in the community level. So when a child does not come for a rendezvous, the health facility can work in collaboration with the community to do active search of these children. Such that even with a denominator problem, the most essential thing is to reach every child. So if all the children who are supposed to be vaccinated or are followed up are reached with the help of the community, I think the denominator problem, those who are up in the hierarchy are the ones who are going to decide on that. But we have to ensure that all children are vaccinated, or at least we have to ensure that we reach a realistic coverage in our communities, which is real and not based on denominators. Because some denominators, you will see that when you carry out monitoring, by mid-year, you have already even achieved more than 100% coverage. That shows that the denominator has been underestimated. There are others that at the end of the year, you see that you have not reached even 60%. Maybe the denominator has been overestimated. But if you do the real work on the field to get every child, I think that's the essential, because at the end, coverage surveys is going to prove that majority of the children, or if not all of the children, have been vaccinated. So that is what I thought.
All right. Thank you, Olivia. Jan or Rizwana, would you like to follow up? Perhaps hearing Olivia makes me wonder what's her context, what Rizwana and Jan, are you able to?
Yeah, we just lost you right after for a few seconds. That's why you froze.
Okay, yes. So just turning back to you to see if you had follow-up questions or comments for Olivia, or any further questions before we move on to the next question.
No, I mean, just to say, I think the ambition to sort of link births to the immunization program is a really good one to have. Having said that, I think, you know, as Olivia's experience has sort of clearly highlighted, it's not always as straightforward, and it is more of a, I would say, a longer term initiative that countries can and should probably reflect upon, but really understand the kind of the intricacies and the complexities and the level of effort that it would require. But of course, you know, in the ideal world, if we were able to do that, that would make the estimation of the target population much, much better.
Yeah, and I also, from my part, I totally agree with Olivia that one thing is denominator and the other thing is making sure that all children are immunized. So to the extent that you can use community health workers or community representatives at the lowest level, this is really a best practice. I think this is really good. I think what it shouldn't mean is that we just take that for granted, because like if the data that comes up that way is not quite reaching as much as what our population estimate is, we need to find out if we're not missing communities. You also mentioned, okay, we work with community leaders, but maybe there's different communities that are not represented that we don't listen to. So in the context of equity, it's also important that if we do that, we kind of reach out to all communities. of different maybe ethnicities or people living in slums as well, and make sure we have all the bases covered. But I totally agree that the most important thing is actually targeting all children for immunization.
And sometimes it's making use of different multiple interventions at once that allow you to actually do that more effectively.
Great, thank you, Jan and Rizwana. I may be having some connection issues, so don't panic if I drop out. I'll be back as quickly as I can. But I wanted to ask Jan if there are specific comments from the chat that you would like to highlight or bring our attention to before we move on to votes.
No, I've been looking at chat and there's a lot of people endorsing processes and kind of giving small but really useful suggestions. So we try to kind of also look at those and incorporate those. I just want to say that denominators, of course, it's a world of its own. We are going to have a specific dedicated webinar on denominators also, like I think it's the third or fourth. And we'll try to answer some of these questions and incorporate some of the suggestions you had in that webinar, maybe then trying to address it all right now.
Great. I see Farhan Ali has been able to unmute and has microphone connected. That's wonderful. So Farhan Ali, you asked a question, how could we improve immunization data of cross-border populations, so nomads, migrants? Could you introduce yourself?
Okay, how are you, everyone? I am...
why you are interested in this question?
Okay.
Yes, please.
Okay. Hello, everyone. I am Dr. Farhan Ali from Djibouti. I am a API manager. So I ask this question because, as you know, the cross-border population are really very sensitive, especially in areas where population mobility is very important. So these populations settle in majority in countries are not stable and sometimes at zero doses and complicate the balance of this country public health system. So we have in the east region of Africa, we have this problem. So we would like to know some strategic, some plan to improve our monitoring system in those populations. Thank you.
Thank you, Farhan Ali. Over to you, Jan and Rizwana, and then we'll look at the maybe some of the comments. But we do have conscious of the time. We have 60 minutes left for this event. So up to you, Jan. How to make the best use of that, the remaining.
I think we'll try to address it briefly here. Also to say that again, it's about denominators, so it is indeed the most burning issue that most people will have. So I think we want to really kind of, again, we'll have a webinar on denominators and we'll discuss it there, and we'll really try to go into these different specific issues with denominators. And I think you mentioned two. So cross-border populations, nomads and migrants. So there are actually two different problems, I think. So the migrants, first of all, so people who might be either internally displaced or coming from a conflict area near your country or your region. That is actually a very urgent one in many conflict-afflicted areas. Of course, we are totally aware of that. And there's a number of modalities that can help with that. So the first modality, of course, if migrants or internally displaced people live in camps, you can actually have a specific denominator for that group and try to even kind of measure progress against that group within that camp. But it's not always so easy. In many cases, they don't stay in camps, but they mix with the local population. And then we really have to think, okay, if this influx is really important, we need to really kind of take account for that. And as you say, target those people specifically, because a lot of times those people will also be zero dose or never reached by the system. So in terms of equity and disease control, both, it's very important to actually prioritize those. So what can be done anyway? So together with the statistical service or other kind of sources, we can try to find out how many people migrate into a country from a different country, even on a temporary basis, and then allocate that denominator over the districts and the regions for that specific population, and have specific strategies to reach them. I don't think we can go into much depth right now, but again, this is something we should actually discuss in that webinar and denominators. Rizwana, and also I see that Carolina is on the call, so maybe Carolina could also add her 10 cents to this. Rizwana, do you want to add something?
Yeah, I think, you know, as Jan said, that particular context is, I mean, the nomads and the sort of the internally displaced or the migrants are two different issues and should be tackled differently. In terms of the nomads, because generally this kind of population in general, I would say, we are sort of more aware of their patterns, sort of where are they headed, at what time of the year they're staying, where and what. Sometimes it's easier to actually plan the delivery of immunization-specific tailored strategies that target that particular population. So in Chad, for example, one of the suggestions that they had thought about was doing those kind of caravans and understanding exactly in which kinds of oasis the country, the nomads would stay at for a number of weeks or days, and then, you know, making sure there was a mobile clinic that would go there. In terms of the internal migrants, I think, or the sort of the displaced populations, I think Jan mentioned it, you know, when they are grouped in camps, it's relatively easier, but can be tricky. But as soon as they get into the population, I think it can be really tricky. It's not really from a systems perspective, but it could even just be from a political or governance related perspective, depending on, you know, sort of their status in country and to what extent they're recognized and they're easily trackable. There's no sort of one size fits all. I think it's a lot of like learning on the go. And certainly another topic where it might be really helpful for all of you to exchange on that and to learn from one another.
Just before we go to Carolina da Navarro, I see many of you are asking or finding that the resource folder currently seems to be empty. So as Alain Blaise Tatsinkou has already responded, but I just want to say it out loud. Keep the link. The resources will be added after you have attended the webinar. Over to you, Carolina.
Hello. Good morning. Here in Seattle is 6 a.m. Just want to add to what has been said is that the denominator is a really complicated issue, but more and more countries can work with National Bureau of Statistics. There are some attempts at looking at the usefulness of potentially of GIS to track populations and to have a sense of counts. But I always like to bring people back to remember that EPI has more control over the numerator, and there we are not done yet. So think of how you can compare what you did last month to this month to next month. The seasonality for the different populations that move can really help you understand where people congregate one part of the year, and really look at your data critically so that you understand if there are funny patterns that can suggest some issues on the numerator as well. Thank you.
Okay, back to you, Jan, either for further comments, or if you spotted in one of the comments under Farhan Ali's question, someone that would be good to perhaps hear from. Otherwise, we'll move on to the next question.
Sure. So I think let's skip the questions on population data, because we will have a specific webinar and we talked quite a lot about that already. So then we can talk either about the next question would be, how can we develop EPI microplans? And EPI microplans, maybe we can actually reformulate that a bit and say, how can we use data to formulate EPI microplans? We can focus on that question. And there's also an interesting question about what are the steps in validating data sent from health facilities to avoid missing information. So, but let's maybe start with the EPI microplan.
All right, so I'm going to, Aung Zaw Hitike. So Aung San Suu Kyi, if you could have activated your microphone, but now you need to unmute. You do that if you're on your phone. You tap on the microphone button, and that should give you the ability to speak to us. We would love to hear from you. And otherwise, we have Usman Sule, who who says the planning should involve all stakeholders. Who's Damilola Esther, again, who talks about stakeholder involvement. So let me see if either of them is available. And let's see, so if you see your microphone suddenly becoming active, don't panic, we can't hear you until, this is the key step, you have to unmute yourselves in order for us to be able to hear you. But we would love to hear you on this question. Otherwise, we'll go straight, given that the time remaining is counting down, we'll go straight to Jan and Rizwana and Carolina for comments, suggestions, thoughts, and advice. I think Jan, if you would like
so maybe I can wrap that up. So it's actually very important, and that kind of we use data for micro planning. So, but what does it really mean? I think this is a discussion that we could have, because like it's really kind of best use of the target estimates and finding out where the unimmunized are to kind of to plan your strategies, of course, and say, okay, where should we go out, do outreach, where even door to door, and for which areas do we need to kind of have routine immunization sessions. Apart from that, I think a better understanding of population and why people are not immunized can actually help you tweak some very simple things that could have made big difference. For example, opening hours in an urban situation, for example, and things like that. I guess here we won't go into depth on kind of how to make a micro plan, and I think yes, community involvement is very important. But what we would like to do during the course and during the webinar is actually how can we make sure that those micro plans and actually plans at all levels use data for their purposes, because if they don't use that, then there's no use in collecting the data, right?
And
go ahead.
Maybe just to add, I think, one key lesson I perhaps have learned in the last few years working for Gavi is that if you want a microplan to be really successful, it's not just about looking at coverage data, but it is also expanding your scope to thinking about, your facility data as well as sort of your stock data. So trying to think about kind of your operational data along with your coverage data to understand exactly, what are the needs of the population? Are you missing out on some pockets or not? And then, as Jan said, if you are missing out on some pockets, what's the actual root cause? Is it because you're not reaching them, or is it because there's another underlying reason why these people are not being vaccinated?
All right, thank you, Jan and Rizwana. Carolina, any additional comments on this issue? We are running out of time, so my suggestion would be to go to the final Mentimeter polls and a reminder about the upcoming webinars. This is the first one kicking off a series. So yes, Carolina.
Real quick, maybe as Rizwana and Jan have already said, look at all your data, not just focus so much in the coverage calculation. And that can really give you clues as to, are you missing people? And if so, where, and how you can do a micro plan to catch them. Thank you.
Great, thank you. So we have 5 minutes, 5 minutes left. Jan, yes, great. So I believe Jan has prepared a poll, a Mentimeter poll to ask you which of the next webinars are you interested in. I'd like to emphasize, please, yes, I guess so. It's not whether or not you'll be able to attend, yes, is a separate matter. But in terms of which ones you would like to attend, as I understand if I understand the question correctly. So again, go to menti.com and then use the code 463852. And this is how you can let us know where your interest lies.
Maybe I can quickly summarize also the objectives of those webinars. So next Wednesday, we'll actually talk again about use of coverage and equity data, and actually have a bit more focus on equity, as this is now kind of the burning topic. Not just like how you can use that for your country, but also like where to find it at the global level. And we'll try to kind of provide you with kind of data sources and things that could be useful. On the Wednesday after that, we'll talk about the health workforce, the data use culture, and how to best do workforce development. October 16, I think we expect a lot of people for denominators, because yes, it is often a big issue in many countries. So denominators on October 16th, and we'll try to actually, some of the things that we didn't get to answer right now, I think we'll really try to make sure we answer in that webinar. On November 6th, a webinar on HMIS and integration. EPI systems versus national health integrated systems, and how can they work together. And the final one on November 13th already, kind of digital systems, where we can talk a little bit about electronic immunization registers, LMIS, the use of geographic information systems, and kind of some of the newer systems that are out there. So what I see from your interest, and thanks for indicating that, is that of course a lot of interest about denominators, but also for data for coverage and equity. Data use culture and HMS. I think actually it just means that a lot of you are planning to attend most of the webinars, which is great to hear, and we'll make sure that we prepare a good presentation for you that can be engaging. So thanks a lot for that. I have a few more slides. Reda, do you think I can go through it real quickly?
Yes, please. Yes.
Okay. So this is a nice visualization, isn't it? But so yes, a lot of interest in the webinars. I think on the next page, we actually have this, the slide deck and other resources. So there's another Dropbox links that is there that you can use to download the resources, but also the one that Alain has put a number of times in the chat box. So I will make sure it's actually filled, because right now there's nothing there, and I'll make sure that all the resources are in there. Also to just say that we had like a series of webinars last year, and all these webinars were taped. So you can also watch those and look at the presentations if you want from last year, in case that's of interest to you. And I think this is the final slide probably, which is really kind of the time schedule for the series of 6 webinars. So the English ones are all at 2 p.m. We also have Francophone ones at 12 at noon every day, the same day, the Wednesdays. And they will be 2 weeks later for the Francophones in this group. And finally, I think there's a link that you can use to share your feedback on this webinar. I think for me that was it. So thanks a lot for all the interest and staying even until the end, and all the questions and suggestions. So Reda, if you want to sign off, and Rizwana, if you want to say something. Somebody's asking, do you have the recording available for us? Yes, we'll also put that recording in the resources box once it's finished. It should be there in a few days.
Yeah. Rizwana?
Just, I wanted to thank all of you and to stress again that, you know, a lot of the questions you've asked, I think Jan would concur with me that we don't necessarily know all of the answers, that we're also grappling with some of the issues that you're grappling with. So really encouraging you to share your learnings amongst each other, and you know, and by trying and learning, that's how we're gonna figure out better ways of improving data over time. So thank you very much for your time and attention and participation.
Great. Thank you, Jan and Rizwana. So we're going to close this very first webinar, but keep in mind it's a series. And I think the challenge of participants, you made it, you figured out how to work out. And for the next webinar, could I challenge you, if there's this commitment to improving immunization data in your context, wherever you work, grab a colleague so that, you know, let's see if we can double the number of people in attendance for the next webinar, given that this is a series. Also, I was very impressed by the fact that Jan and Rizwana referred back to work developed by participants in the data improvement course last year, and we look forward to your, and I wanted to acknowledge and recognize your attendance today, even though you have probably attended the first edition of the webinar, and I see many of you in the room, so your support and presence are much appreciated. That's it for me. Thank you for joining, and look forward to the next one in the coming weeks. We'll be spending hopefully some quality time together, so very much looking forward to that. Thank you, and take care.